There are two main types of diabetes. Type 1 diabetes, which used to be called juvenile diabetes, and type 2 diabetes, which used to be called adult onset diabetes. And this reflected two different diseases and different populations that were at risk. Type 1 diabetes tends to occur very suddenly. People are fine one day and the next people find themselves urinating too much, whereas type 2 diabetes is very gradual in onset, and many days it's just picked up by blood work. The type of people that get affected with these diseases also tend to look very different. Type 1 diabetics tend to be thin, and type 2 diabetics tend to be overweight. But perhaps the most important thing is that type 1 diabetes is an autoimmune disease caused by destruction of the pancreatic beta cells and tends to be progressive. We don't really know what causes it, whereas type 2 diabetes is a reversible disease and mostly associated with weight gain. And when people lose weight, they almost always get better or even reverse their type 2 diabetes. And all about trying to lose weight, and that's the problem. If you lose weight, you'll get better. It's all about the diet. In type 1 diabetes, the pancreatic cells get destroyed and insulin levels are too low. So a drug such as injected insulin is going to work amazingly well, and it did. But for type 2 diabetes, your insulin levels are too high. So giving more insulin is not the answer. In fact, it's going to make you gain weight and make things worse. You can't treat a condition where insulin levels are too high by giving more insulin. So what kind of diet did Mark use to reverse his type 2 diabetes? It was a low carbohydrate diet and intermittent fasting. Mark had developed type 2 diabetes but also had complications, including stage 3 chronic kidney disease. And he was worried that things would continue to get worse. He was given more and more medications, including insulin, until he read the obesity code and the diabetes code and concluded that perhaps that was not the best way to go. What he did was he started fasting. He slowly increased his fasting from 8 hours to 16 hours to 24 hours. And gradually, with his physician's help, he was able to slowly lower the amount of insulin that he was taking. That was a major step. His hemoglobin A1C started to drop, he started to feel better, and then he also started to cut down on his carbohydrate. Sometimes his sugars would go back up, but then he would think about the damage that can be done from type 2 diabetes and that specter of kidney disease. So he went back to it, doing 24 hours and sometimes a 30-16 protocol where he alternated 30 hours with 16 hours. And he was able to get his hemoglobin A1C down to a normal range and get off all of his medications. By definition, he had reversed his type 2 diabetes. His kidney function stabilized, and he was told that he wouldn't have to worry for the time being about getting worse, going on dialysis, kidney transplant, that kind of thing. That's a great job, Mark. Hopefully, this will inspire people to look again at the diet as a viable treatment for weight loss and reversing type 2 diabetes.